had one of the senators who was at this quote-unquote super spreader event, as the media has called it, the Amy Coney Barrett nomination. Senator Tom Tillis was wearing a mask at that event, and yet he was still diagnosed with COVID afterward. What's your read on masks? Do you think there should be a repeal on mandating masks, or should masks be mandated?
Masks should not be mandated. Masks have a use in certain settings where people use them properly. So, for instance, in hospital settings and places where you can't avoid being in very, very close contact with people that are vulnerable, they might have some use. A mask mandate, like the ones I think I've heard some politicians propose, I think are not supported by the scientific data. So, for instance, if there is no randomized evidence that suggests that mask mandates would work to slow the spread of the disease. In fact, for influenza, the randomized studies that have been done suggest that they don't work to slow the spread of the disease. I'm not saying I'm not against masks. I think that, again, as I said, they have appropriate uses in appropriate places. We should take seriously what the scientific evidence is saying and not adopt policies that are far beyond what the scientific evidence has said. There's a reason why early in the epidemic that the World Health Organization, CDC, didn't recommend masking sort of all the time. I think there are also some enormous social harms caused by these masks. Masks have become a political issue, a partisan issue, right? You wear a mask if you're a Democrat, and you don't wear one if you're Republican, and you look on your fellow citizens and say, well, you're being irresponsible, or you don't care about freedom. I think public health should unite, not divide. And masks, I think, have become an issue, especially these mandates. When it turns into a political issue like this, we have to think, as public health, folks who do public health, we have to think very carefully whether we've actually done the right thing. When it turns into a political issue like this, we have to think, as public health, folks who do public health, we have to think very carefully whether we've actually done the right thing. And I think I think we've done a very, very poor job with the messaging, taking the science seriously, and we've created a disunity in the populace around masks, the distrust for one another that public health is not supposed to create.